My name is Patrick Farley. I work at the University of Mississippi Medical Center. These are more cases from CTA abnormalities. 64-year-old with altered mental status. We see some density in the region of the basilar artery. On our MIP CTA, we do not see good opacification of the distal basilar artery. On our angiogram, this is a left vertebral artery injection. We're seeing a lot of reflux into the right vertebral artery, and we're not seeing opacification of the distal basilar artery. However, it was reopened, and now we see opacification of the distal basilar artery extending into the posterior cerebral and superior cerebellar arteries. So that was a dense basilar artery thrombosis. After the intervention of the angiogram, the patient. This is a 39-year-old female with altered mental status and pulse discrepancy. On the CTA, we can see enhancement of the V3 segment of the right vertebral artery and the V1 segment of the left vertebral artery. However, if we look on the axial image, there appears to be poor opacification of the left subclavian artery. An angiogram was performed where we can see opacification of the right subclavian and common carotid arteries from the innominate artery. We can see the left common carotid artery, but we're not seeing the left subclavian artery very well. On delayed images, we can see that we're slightly opacifying the left subclavian artery, but on very delayed images, we can see that we have good contrast in the left vertebral artery and left subclavian artery, and that is indicative of, so this was subclavian steal due to a nonspecific vasculitis, which had to be shown by angiography because that's where we can see the flow of the vessels over time. 55-year-old man, we see hemorrhage in the fourth ventricle and hemorrhage in the region of the brainstem. On angiography, we can see abnormal enhancement of a tangle of vessels in the posterior fossa near the tentorium, and if we look on the delayed image, we can start to see that right transverse sinus filling. The sagittal images of the angiogram again show that early transverse sinus filling and that abnormal vascularity. This was a dural AVF. This is a 16-year-old who had trauma. We can see that there is pneumocephalus, there's intraventricular hemorrhage, there's subarachnoid hemorrhage, and there's some thickening in that region of the right cavernous sinus. There are multiple skull base fractures. A CTA was performed. There's irregularity of that right internal carotid artery and the left internal carotid artery with areas of hemorrhage surrounding. An angiogram was performed, and we can see that there's a large dissection of the right internal carotid artery with filling of the venous system. This was a traumatic CC fistula. This is an outside CT showing an area of hemorrhage in the left parietal lobe and scattered subarachnoid hemorrhage. In the posterior fossa, we can see some density in the region of the venous sinuses. A CTA was performed, and notice the absence of normal opacification of the superior sagittal sinus on the left image, and absence of opacification of the right transverse and sigmoid sinus junction on the left image. When we look at the CTA, we can see that the superior sagittal sinus is not opacified. That is venous sinus thrombosis with the venous hemorrhagic infarct. Remember, the veins often opacify on a CTA, and in addition to looking at the arteries, you need to look at the veins as a source of hemorrhage. This is a 64-year-old with dizziness. There's hypodensity in the right cerebellar hemisphere. On the CTA, we see a focal area of enhancement in that right cerebellar hemisphere. An angiogram was performed. We see some enhancement in that right cerebellar hemisphere, which increases with delayed images. We can see another view of it. This does not appear to enhance to the same degree as the arteries, however. We can see it here, enhancing after the arteries have primarily washed out. That was not an aneurysm, but rather a hemangioblastoma. This 23-year-old was on the roller coaster at the fair. They presented with expressive aphasia. The non-contrast CT shows hypodensity in the left frontal lobe. MRI shows restricted diffusion compatible with infarct. Now, why does a 23-year-old have an infarct? A CTA was performed, and we can see that there is severe stenosis of the left cervical internal carotid artery. That was due to an ICA dissection from trauma. Here's an 83-year-old who had a trauma. The fracture involves the vertebral artery foramen, and that increases the risk of vascular injury. So a CTA was performed, and we can see that there is irregularity of that right vertebral artery. On the coronal, we can see the linear defect, and that is a dissection due to trauma. When you have a fracture through the transverse foramen of where the vertebral artery travels, a CTA is needed. This patient had bleeding following a laryngectomy. When we look at the CTA images, we can see increased enhancement adjacent to that pharynx. Again, we see that abnormality to the right of midline, adjacent to the vertebra, near the tube. An angiogram was performed, and we can see that there is pooling of contrast, and that was the site of hemorrhage. It was from the inferior thyroid artery. The 60-year-old patient has rheumatoid arthritis. We can see that the dens is pretty much absent, that there is some subluxation, and we have some abnormal enhancement in the region of that left V3 segment. On the axial images, we can see abnormal enhancement within the soft tissue area in the region of the V3 segment of the vertebral artery. And that was a pseudoaneurysm related to the rheumatoid arthritis pannus. As a recap, thank you for reviewing the CTA cases. Remember to follow each artery as you evaluate the CTA, and remember that many vascular abnormalities can be seen: aneurysms, occlusions, dissections, tumors, and others.